Hi, and welcome to the Always Evolving podcast. I'm your host, Dr. Elizabeth Fedrick. Life is all about changes and transitions, and one transition that we're never fully prepared for is becoming a parent. This life change is one of the most beautiful and yet hardest things that most of us will ever experience. And for a lot of new mothers, this can lead to something that is frequently referred to as the baby blues. While it's a common experience, it's still really hard. And joining us today is Joanna Rogers, licensed clinical social worker. Joanna is here to chat with us about the postpartum baby blues and provide some signs to when it might be time to seek professional help. It's okay that we don't have it all figured out. We're all just taking it a day at a time. This is Always Evolving with Dr. Liz. Joanna, I'm so happy to have you here. Welcome.
Thank you so much for having me today.
Absolutely. Tell everybody who you are, what you do, what you specialize in.
Yes, I'm Joanna Rogers. I am a licensed clinical social worker in Colorado, and I'm the owner of Elevated Life Counseling, and I work with moms, specifically moms who are pregnant and postpartum, working through some of those struggles that they have in those transitions.
Yes. And as we were talking about before we started recording, Joanna is also one of me and Joanna are, I guess, the original Evolve counseling therapist. So Joanna has been my day oneer. So I'm so excited to have you here.
Yes. A lot of kudos to you to where I am today, because I wouldn't have gone into the private practice world without you.
Well, thank you. And same, because I needed you to help me get up and running. So I appreciate that. So when we talk about becoming a parent and this new experience, of course, it's hard for everyone. It's hard for both parents. It's hard for sometimes the support system.
Mm-hmm.
But sometimes it's even more hard, and it leads to these symptoms that can really often are dismissed or minimized. Tell us about what are the baby blues and what does that look like for a lot of people?
Sure. Yeah. So a lot of people don't really know this going into pregnancy, but there are so many changes, as we know, that happen in pregnancy. And then after you give birth, after about 2 to 3 days after, you can experience what's called the baby blues. It's not a mental health diagnosis or anything like that, but what researchers kind of are gathering is, if you think about it, when you are pregnant, you have 40 weeks of just hormones going, and you're at your peak. You give birth, and then hormones just kind of are trying to level out, and they're going crazy. And so emotions are going to happen, especially because it's a big transition. You just gave birth to a beautiful little creature, right? That's ready to be in this world. You're also transitioning into a new role, whether you're a first-time mom or you're a mom of 5, right? It's still a big transition. So you have these mood swings. You might feel really reactive to maybe what your partner's saying to you, maybe even to what your baby is doing, right? Maybe your baby's crying and you can't get it to calm down. Maybe you're really reactive to that. And so with baby blues, we see just mood swings, crying spells, overwhelm, really typical emotions that are going to happen. But a lot of moms are like, what's wrong with me? What is happening? And so it's just really important to remember that it's very valid. These emotions are valid, and it's very true and real that are what's happening in the experience that you're going through.
And it can feel so conflicting because we are supposed to, right, in air quotes, this is supposed to be the most joyous, happiest. We're supposed to have this immediate bond with this creature that just crawled out of us. And we're just, that's not how it always is. It can be confusing, and we're tired and overwhelmed and exhausted, and our bodies hurt. And that needs to be validated.
Well, it needs to be normalized that this is a big change and a big shift that's happening, because we see on social media, right? We see that these 2 weeks should be bliss. We see that these experiences, we should be able to get up and back to our normal lives. But really, there's really no need for that.
Right. So when it starts to transition into something more, though, so it's very normal to, whether in the first couple weeks or, whatever that time frame is, to feel the ups and downs, the hormones. When does it start to become something that is more of a concern?
Yes. So really, I'd like to explain to my clients that, like, if you're seeing your patterns and themes, is what I like to say, patterns and themes of like hopelessness, patterns and themes of sadness, crying, and it's still happening after this 2 week, experience after birth, and you're seeing maybe it ramping up, it's not
Mhm.
slowing down, maybe even you're like, wait, I do not feel like myself, which we're not going to feel like ourselves, women,
Right.
afterwards. But if we're starting to see that after the 2 weeks, that's when I say that let's explore that a little bit more. Let's see if this is more of a mental health diagnosis, something that maybe you need support from. And so, really, baby blues can last only 2 days. Like, that's another important thing to remember too. It could last for 2 days, and then maybe even like a month later, you're starting to see themes and patterns again of sadness. Maybe you're seeing themes and patterns of anxiety. Really, just these big hormonal shifts that aren't only happening, but also these emotional shifts that are happening as well.
And this is important not only for the mother going through it, but also for the partner and for the mother's support system and
Mm-hmm.
friends and loved ones to understand that, first of all, to normalize the ups and downs, but then also to be aware of there are signs when we maybe should be encouraging them to seek some professional help, or and that is not a sign that they're not happy about their
No.
baby or that
Yeah.
they're a bad mom. That's not what it's about. It's that they're struggling and they need
Mm-hmm.
help.
Yeah. So some signs to look for, like if your partner, if the mom that just gave birth is maybe losing an appetite, right? Appetite changes. They're more irritable. They're more they're unable to like focus, they can't concentrate, maybe they're even having constant worry, maybe they're even worried about their baby's health or even their own health, like they're like constantly worrying about that. Maybe you're seeing just like excessive crying, hopelessness, helplessness,
Mhm.
right? Feeling lonely as well. Those are some signs. And then there's some obvious really concerning signs too that happen after postpartum as well, is when we see moms who maybe have thoughts about suicide, maybe thoughts of harming their child. Like, that is a huge indicator that they need help right away.
Yeah.
Um, and then the other signs as well, just kind of recognizing that, yeah, support may be needed. And it might be important to sit down with her and just check in with her and share with her that, there's therapists out there
Right.
that really care and that want to be there to support them and help them with this transition.
Yeah, and people who specialize in it and will know
Mhm.
what to say and how to help. As a loved one, seeing these signs in this mother, so whatever their role is in your
Mhm.
life, how do you suggest maybe having this conversation so that it doesn't come
Mhm.
across as judgment or blaming,
Yeah.
shaming, that it's safe? What would that look like?
Well, I think it wouldn't be in the moment, right? Because
Valid.
a lot of the times it's probably they're sharing these emotions because the baby's crying, or maybe they just got the baby to sleep and they're feeling really maybe defeated that, like, oh, I couldn't get the baby to sleep until like 2 hours later, or whatever the case may be. But just finding a time to sit down with them and sharing with them your concerns, not pointing
Mm,
out like what's happening to them, but your concerns that they're seeing, you're that, I'm noticing that you're really sad and that you're not connecting with me or with the baby XYZ, those
sure.
types of things. Maybe just sharing that, that you do love them and that you do care for them and that there's people out there to support them. And just recognizing that also it doesn't mean that they're not a good mom. A lot of the
Mhm.
times, good moms go to therapy. I say that all the time to my clients because they're always constantly worried about being a good mom. But if you're not worrying about being a good mom, then, you know.
Yeah. No, that's the sign, right? That
Mhm.
if that is a concern of yours to show up as the best mom that you can be,
Exactly.
and you're worried that you're not, that is such an indicator that you are, because it is on your mind, it's a concern, and then you're seeking help and trying to do something about it. And
For sure.
so, yeah, it definitely should be normalized. Any tip for the mom listening who maybe the new mom,
Mhm.
or um of how to seek help, what to look
Yeah.
for even when looking for someone who specializes?
Mhm. So I would say, if a lot of the times mom have instincts, right? We have these instincts that like I maybe need to see somebody, and a lot of the times that instinct is right. And so I would first say, go with your gut, go with your instinct. If you're not feeling like your normal self, if you're realizing that, meditation isn't helping, right? Those types of things, then yes, find a therapist. You could look for anyone who's specializing in perinatal mood disorders. Those individuals are individuals who know about postpartum depression, postpartum anxiety, and all the other actual diagnoses that can come with postpartum as well.
Yeah. And I think that is important that you are looking for someone who specializes in this experience versus a general mental health therapist because it's specialized and you need that specialized help. Joanna, where can people find you? I mean, your socials, you do such a good job of really normalizing motherhood and providing support for that. Where can you be found online and social media?
Yep. So my website is www.theelevatedtherapist.com, and I am on Instagram at the.elevated.therapist. I also want to say that I provide therapy to Colorado residents and Arizona residents as well.
Very cool. Joanna, thank you so much for joining us and for giving such helpful takeaways on this very valid experience.
Thank you so much for having me.
And thank you all for joining us on the Always Evolving podcast. Make sure to subscribe to our YouTube channel, sign up for my newsletter, and find me on Instagram at Dr. Elizabeth Fedrick. This is Always Evolving with Dr. Liz.